Whether you're dealing with harsh soaps or a yeast infection, these simple treatments can provide relief. Vaginal itching that just won't go away can be uncomfortable to talk about, and even more uncomfortable to deal with. But before you assume you're dealing with something like an infection, it's important to know the other common causes of vaginal itching. Constant discomfort. There could be something as harmless as irritation from a dull razor or a soap that's too harsh on your skin, but it can also point to medical conditions, like bacterial vaginosis or even a sexually transmitted infection. For vulvar itching caused by atopic dermatitis. When you're dealing with external itching and redness on the vulva, not internal itching that stretches into the vagina, it may be atopic dermatitis, or inflammation of the skin. According to doctors, about 25% of the time when women come in and get tested, they won't find an infectious cause of their symptoms. That means the itching may be caused by lifestyle factors or other conditions. Consider the following if this sounds like you. Invest in new razors. Dull razors can aggravate the skin around your vagina, causing irritation, redness, and itching. Keep a specific razor handy for the genital area, yes, meaning you should use a different one for your armpits, and swap it out for a new one around every 5 uses. Wear loose, breathable clothing. Tight clothing can rub against skin and cause discomfort, especially in warmer temperatures. Opt for 100% cotton underwear when you can, but especially while you sleep, to allow more breathing room around the vagina. According to doctors, for mild, non-specific itching, they have patients apply something that's bland and soothing with no active ingredients in it. That could be petroleum jelly, coconut oil, or even Crisco vegetable shortening. Just putting a little on your finger and rubbing it into the areas that are itchy can be very soothing. For vaginal itching caused by sex. If you recently tried a new personal lubricant with your partner, or you aren't using enough, it may cause vaginal itching and discomfort. Many lubricants have alcohol in them, which can be very irritating to the vaginal area, and some people might have an allergy to something they are using, including latex, which is found in the main types of condoms. Having intercourse without adequate lubrication can also cause a lot of friction, which can cause itching. Get picky about personal lubricant. Coconut oil is actually a good natural lubricant to consider, unless you're using condoms. Oil degrades the quality of latex. Opt for a new condom. Consider polyisoprene condoms if you have a latex allergy. The latex-free condoms are pre-lubricated, soft, and ultra-comfortable. For vaginal itching caused by soaps. You've likely heard that douching is not welcomed by your vagina, and can throw off its natural, healthy bacterial balance. Even if you're not douching, however, the wrong soap can get you scratching. In general, products used in the vaginal area shouldn't have any perfume in them, and should be as gentle and mild as possible. Use something gentle. Dove bar with no perfume, which is very moisturizing. Only use it on the outside of the vagina, the vulva, not on the inside. The vagina is a self-cleaning oven, and you don't have to clean it yourself. And steer clear of feminine sprays, wipes, or deodorants. It's normal for the vagina to have some sort of scent, but see your doctor if you notice an unpleasant odor. Feminine products can also throw off the natural balance of bacteria in the vagina. Case in point, in a study from the University of Guelph in Canada, researchers surveyed nearly 1,500 women about their feminine hygiene habits, and a majority of them reported using at least one product, such as feminine wipes, washes, sprays, and powders, in or around their vaginas. The result? Those women had a 3 times higher chance of experiencing some kind of vaginal health problem, like an infection. For vaginal itching caused by bacterial vaginosis. Despite its scary name, bacterial vaginosis is actually a very common infection, and occurs when an overgrowth of the vagina's naturally occurring bacteria causes inflammation. Although it can affect women of any age, women of reproductive age are most likely to contract it, and frequent douching and unprotected sex increase your risk. Symptoms beyond itching include a gray discharge and a signature fishy odor. If you think you might have bacterial vaginosis, make a doctor's appointment. You'll likely need an antibiotic to treat it. Consider a probiotic supplement. Probiotic supplements may prevent bacterial vaginosis from becoming a chronic issue. As they do throughout the rest of the body, probiotics help build up the good bacteria in your vagina and prevent the bad bacteria from growing out of control. Probiotic feminine supplement is clinically tested and specifically developed to balance both yeast and bacteria, but talk to your OB/GYN before you opt for popping a pill. For vaginal itching caused by a yeast infection. If it's the first time you've experienced yeast infection symptoms, it's important to see a doctor to rule out other issues. Along with itching, a vaginal yeast infection may cause a burning sensation, particularly during intercourse or urination, a vaginal rash, thick and odor-free vaginal discharge that resembles cottage cheese, or even watery vaginal discharge. For vaginal itching caused by menopause. The lower estrogen levels you experience as you approach menopause can actually change the pH balance of your vagina, causing the vaginal walls to thin and dry, a condition called vaginal atrophy. Estrogen decreases throughout your lifetime, but it can cause symptoms including itching, irritation, and painful intercourse. Prescription treatment can be very helpful, but is not an option for women with certain health problems. Try a vaginal moisturizer. It's best to talk to your doctor about the best options for you, but an over-the-counter medication vaginal moisturizer. These products can ease dryness by helping the vaginal tissues to become thicker and more elastic, resulting in increased lubrication. What if treatments aren't working? Though vaginal itching is a common issue, it is important to remember that itching that is recurrent, persistent, or not responding to treatments recommended by your doctor can be signs of more serious medical problems. For example, recurrent yeast infections and itching may be a sign of underlying prediabetes, especially when not responding to usual treatments. Persistent vulvar itching not responding to typical medications may be a sign of dermatological conditions, such as lichen sclerosis or even precancerous changes of the vulva. If your itching is not improving with typical treatments even after seeing your physician, don't ignore it. Check back in with your doctor to ensure nothing more serious is causing your discomfort. Share with us what are your own tips for healthy vagina. And also do let us know in the comments on what topics you want us to make our next video. Don't forget to hit the like button and subscribe our channel for more informative topics for your healthy life.